Okay, let's start tonight's show with a better understanding of this abuse that we are talking about. Let's do some introductions of our first table here, starting with Nicole Gaddis with the St. Louis College of Pharmacy. Also with us, Jared Opsahl with National Council of Alcoholism and Drug Abuse. And welcome back to the show, Dr. Heidi Miller, the Family Care Health Centers. Thank you all for being here. Okay, so we just saw some statistics there talking about Adderall. We also said that 7 out of 10 most abused drugs are prescriptions. What are these drugs we are talking about that are being abused?
Well, you just nailed them all right there. Usually younger kids are using Adderall and Ritalin. What we're finding is they're using them as study aids. They're using them around finals time for college kids and for high school kids. And they're not even recognizing that these things can become dangerous when they're using them. And the most dangerous of this group is painkillers. You mentioned the link between painkillers and heroin, and we are seeing that with the people that call NCADA looking for help. Nearly every single one of them says they began abusing prescription painkillers before they were using heroin. And these are younger people and older people.
Similar things you're seeing?
The painkillers, OxyContin is the one a lot of people think about, but it starts even less than that, like hydrocodone or Vicodin usually is the first one people start taking before they get to the heavy hitters, like OxyContin.
And who? Who are we talking about? You said kids, but what does that mean?
So it can affect anyone, any socioeconomic status, any age. 15 years into practice, I continue to be surprised about who is susceptible to this. I am surprised by the percentage of patients who are susceptible to it. Although there are some subpopulations that have a higher risk, and that includes the younger population as well as healthcare providers.
Is there a sense sometimes that these drugs are safe because they come from the doctor at some point, whether they were given to that person or not?
There absolutely is, and it's one of the big myths out there. I can take this, it's safe, the doctor prescribed it to somebody, so it's okay. But it's tragic. My cousin actually took 2 tablets from another person's home. The bottle said Xanax. It had methadone in it, and he ended up dying. So 2 tablets of something you think is mundane. It's tragic. It's really tragic.
I did not know that. I'm very sorry to hear that. That is tragic. You're right. Is that an isolated incident?
Absolutely not. Every single year, over 20,000 people are dying from prescription drug abuse. 20,000. That's more than every other illegal drug combined. It just overtook highway car accidents as the #1 cause of accidental death in the U.S. And these are shocking statistics, and we really need to start paying attention. I'm glad you're covering this topic on the show to help us raise awareness of this issue so parents know, so kids know.
And it's amazing how pervasive the misconception is that sharing drugs is fine. In the same way that, a woman can reach into her purse and say, I've got some Tylenol, if someone is hurting, someone else offers some help, that should all be fine. Like, well, instead of Tylenol or ibuprofen, I've got a little bit of this drug that my doctor gave me. It helps my back pain. I bet it'll help your knee pain. And it's so interesting that patients come into the office and they freely share that with me without any awareness that there's something wrong with that.
Go ahead.
It goes to show that we really need to get the drugs out of the homes too. A lot of the children, especially that are becoming addicted, are doing because they're taking it from their parents' house or friends get it from their parents. And so it doesn't even, I trust my kids. I hear that all the time. I said, yeah, but you don't know your kids' friends. If you're selling a house even, people go through open houses to look and see if you have meds around.
Yeah, we are fighting that perception that we've been conditioned our whole lives to believe we go to a doctor, we get a pill, it's going to be okay, it's safe. And we've completely lost sight of all the side effects that can come from those pills, that abusing those pills can be dangerous. What's happening right now a lot of times is someone will pop a couple Vicodin, go out and have some beers, and not realize that alcohol and a painkiller combined work in a synergistic way to where they're really setting themselves up for a dangerous situation where they can overdose and die.
So where did that comfort level come that you can share a prescription as easily as a Tylenol, and how does that change?
So I think these drugs are more available than they ever have been before. The culture in medicine has changed. So in the 1800s, in the medical literature, there's documentation that pain is good, pain reflects vitality, and that pain helps healing. And then during the last 50 years, actually the last 20 years in particular, there's been this emphasis that there's this epidemic of untreated pain, and doctors haven't been trained to treat pain, and that we're doing an insufficient job. So even in 2001, California instituted a law that all providers had to do a one-day course on pain management. And now with this epidemic of addiction and drug abuse, I really wish that doctors had the same obligation to do a one-day course on addiction.
I want to talk about the Affordable Care Act. We're going to talk about the role that mental health plays in this discussion later in the show, but I know there are some changes coming with the Affordable Care Act. What do we mean when we hear about parity with mental health coverage, and how will that play into this discussion?
The hope with parity and with the new Affordable Care Act is that more people will be able to find treatment that need it for an addiction problem to a drug.
And real quickly, what parity with?
Parity compared to another disease such as cancer, such as diabetes.
The health coverage, has to be as good for the mental health.
Exactly. A good example is many times right now, the coverage for insurance will say a person is allotted 10 outpatient visits for substance abuse treatment. Now compare that to someone who has cancer. We do not allot them 10 treatments or chemotherapy, but we're doing it for a different disease with addiction. And many times that takes months, years for someone to be going through treatment to eventually get to a point where they're able to sustain their recovery and their sobriety. And with these new laws, it's really trying to level that playing field to where they can find treatment and find help and save lives.
And that will factor into what we're talking about tonight, you believe?
Mm-hmm. Yes, it will.
So there are a few things that can reduce prescription drug abuse, and that is time, access to physical therapy, access to specialists like neurosurgeons or orthopedics. But unfortunately, Missouri has not yet implemented a massive part of the Affordable Care Act, which is Medicaid expansion. And without those services, oftentimes the doctor's hands are tied and the patient's in agonizing pain and there's no other modalities and the prescription pad is right there.